For more than 40 years, the Samuel Dixon Family Health Center has been providing SCV residents with quality health care services, health education, and resources for the entire family.
The health center has also served hundreds of families during the holiday season with its Thanksgiving meal giveaway, and this year is no different.
So joining us today to tell us all about the Samuel Dixon Health Center is Chief Executive Officer and good buddy Philip Solomon, I'm just going to say it, and Board Chair and good buddy Gloria Mercado-Fortine. Thank you both for being here with us today.
Well, thank you for having us. We appreciate it.
It's great to see you both.
Yeah.
All right, so Philip, before we get into the event that we were just talking about, tell us more about the Samuel Dixon Family Health Center.
Sure. As you mentioned, over 40 years ago, we started out with just one health center in Valverde. But during the last several decades, we've expanded to several locations here in Santa Clarita for healthcare centers. We have primary healthcare services. We also do pediatrics, which is a new program that we're offering. And in the last couple of years, we added behavioral health services. So we have 2 separate behavioral health facilities. And recently, we just got awarded a large federal grant so that we could add substance use disorder treatment for the programs that we offer. You know, a lot of our programs primarily are really targeted for those individuals that may not have health care insurance, can't afford health care insurance because the cost of everything is just going up. So we have a lot of different programs that really tailor to those individuals and families that may not be able to afford health care, and we're there to help them gain access to all these services that we offer so that they could take care of themselves and their families.
Gloria, please tell us about the 15th annual Thanksgiving meal giveaway. The health center identified about 200 families who will be receiving a complete Thanksgiving meal this year. And how are families identified to receive these meals?
Well, they are our patients, basically. So we care for them. And so we go through a process, and we select the 200 lucky families that will be receiving these prepackaged, if you will, Thanksgiving meals. So, turkey with all the fixings, from, mashed potatoes to gravy to green beans, to stuffing, all of that. But we work closely with our families, so we know what the need is. And if we had more and more donations, we could do more than 200. And so, if anybody's interested out there in donating to the Samuel Dixon Family Health Center, we would be very appreciative. But this will take place on November the 23rd, and we do it from 9 o'clock to noon. And so all the families, gather there at our offices, and they pick up their turkey packaged meal. So, and they are very appreciative.
Philip, Gloria just mentioned that you guys have identified the need that your patients have, and,
yes.
and hence that's why the Samuel Dixon Family Health Center is so important and so vital to the community. Can you expand on that a little bit? Tell us why it is so important to the community.
Well, there's not a whole lot of, in Santa Clarita alone, when you think about, the services that we're offering and, really areas of our community that are may not have the resources available to them, or individuals that could afford it. Healthcare services, whether it's dental, behavioral health, primary care, pediatrics, any of those types of services, they're critical for people to remain healthy, and also just so that they could live their lives. Mm-hmm. So the services that we offer really, as I mentioned, tailored towards those individuals and families, so that there isn't a barrier. The cost is not a barrier for them to get that care for themselves and their families. Children require immunizations to go to school, physicals to participate in a variety of different activities, and then adults to stay healthy so they can go to work and care for their families. So our resources that we have available through the years, we have identified the need continues to grow, and we do everything we can to access, those funding resources that we could deliver those services. So, as we started out with just primary healthcare services, we realized that people need dental care, they need behavioral health services, they need substance use disorder. So as those opportunities became available to us, we took advantage of that so that we could deliver the care all under one roof, per se, so that our patients and family members wouldn't have to go outside of Santa Clarita or go to another location to get the care.
Plus, they know exactly everything that you offer because it's all under one
Yes.
roof. Even though you're
Yes.
expanding so much,
Yes.
they know exactly where they can go to
Absolutely.
get that service that
And
they
it's
need.
familiar. They're familiar with us, we're familiar with them, and when you're familiar with the places and people that are caring for you, you're more than likely to show up for your next appointment.
Now, Gloria, where can people find more information about the center, the programs
Well,
offered?
they can go right on our website, the Samuel Dixon Family Health Center website, and they can find out about all the resources and whatever clinic is closest to them. Because as Philip said, you know, we have our Valverde Clinic, our Canyon Country Clinic, and our Newhall Clinic. So we're kind of throughout the valley. So if they can just go on the website and they can find out all the information they need.
Awesome. Gloria Mercado-Fortine, Philip Solomon, the work you guys are doing is phenomenal. Thank you so much for being on the show. Talk a little bit about what you're doing, the expansion that you're getting, the grant. It's really great news. So great work, and thank you so much for being on the show.
Thank you.
Thank you for having us. We
Yes.
appreciate it.
Absolutely. Anytime. Please stay with us. We'll be right back.